one, Madam President. Happy Founders.
How are you? Hi, how are you? Hi, I'm Toni and you are?
Okay, that'll work.
Stamps, Daily, Lowry, Scott, and Miller.
Okay.
Yep, okay, I'll leave it right here.
Sir, introducing the following speaker. Awesome. We're all good? Cool. Awesome.
Hey, how you doing, Commissioner? Good morning, everybody. Good morning, Dave. Hey, guys, how you doing?
Wasn't sure if you were doing anything for Founders Day.
Oh, I got you.
I just thought you were.
Yeah, I mean, it's all right.
Yeah, I heard it. That's what I said. I think we'll talk about that.
Going forward.
Like, is it necessary? I really maybe not. Okay. We ready? Good morning. Thank you, thank you, thank you. I wanted to say, first and foremost, thank you all. Thank you for the media that came out. Thank you to Nick Shields, who kind of walked my communications person and my legislative person just through this process. And thank you, of course, to Madam President and the county commissioners. Today, we are here for a very important matter, and I can't help but be hearkening back to a phrase I used to hear growing up, which is, I know it was the blood. So welcome and gratitude and good morning and thank you all for being here today. It is an honor to stand with so many dedicated leaders and community members as we celebrate National Blood Donor Month and launch the Lifeline Save Chicago initiative. This effort is deeply personal to me as a 25-year veteran educator. I've always believed in the power of education to transform lives. Today, we are using that power to educate and empower communities about the importance of blood donation. This initiative is not just about donating blood, it's about addressing inequities. Our communities of color are disproportionately impacted by the need for blood transfusions, and it's time to come together to change that. I can't help but think about the families, one family in particular, and their young child is in the hospital maybe 60 to 70% of the school year because of sickle cell anemia, often needing blood transfusions, very specific blood transfusions. And so the need to have blood that matches is so critical. We are partnering with schools, faith-based organizations, and community groups to educate and inspire a new generation of donors. This is about creating long-term solutions. So I encourage everyone to join us Saturday, January 18th at the Community Blood Center from 8 to 1. Your donation could save a life, and together we can create a healthier, stronger Chicago and Cook County. And let me just say this. You may think that what you offer, what you donate, is not going to make lasting impact. All of it is so important and so significant in saving lives. And one of the things that I think is really important about the Community Blood Center is that that blood stays within the community, which I think is critical. So I want to thank President Preckwinkle, my colleagues on the county board, and the Community Blood Center, especially Lamikia Davis, for their incredible partnership in making this initiative possible. So without any further ado, I'd like to bring to the podium President Preckwinkle.
Good morning, everybody.
Good morning.
I want to thank Commissioner Stamps for bringing us together. Today, we recognize National Blood Donor Month and reaffirm Cook County's commitment to improving health outcomes for all of our residents. This month highlights the life-saving power of blood donation and reminds us of our shared responsibility to make this critical resource accessible to everyone who needs it. Blood donations save millions of lives each year, yet the demand for blood in our underserved communities often outpaces the supply. This disparity has significant impacts for Black and brown communities, which are disproportionately impacted by chronic illnesses such as sickle cell, diabetes, and hypertension. Many patients depend on blood donations that closely match their own, emphasizing the urgent need for increased participation from communities of color. I want to commend again Commissioner Stamps for her unwavering leadership and dedication to community health advocacy. Thanks to her efforts, we are proud to launch the Lifeline Save Chicago initiative, a transformative program aimed at increasing blood donations in underrepresented communities across Cook County. This initiative is a call to action, a call for our neighbors, families, and friends to step up and be the lifeline our communities need. Every blood donation is an act of compassion and a testament to our shared humanity. Together, we can save lives and foster a culture of health and equity in Cook County. Now I'd like to bring to the podium Commissioner Bill Lowry, who chairs our Health Committee.
Thank you. Thank you, Madam President. I am Bill Lowry. I serve as Cook County Commissioner of the 3rd District. I also serve as Chair of the Cook County Health and Hospitals Committee, and I serve as Vice Chair of the Cook County Health Board of Directors. I want to say thank you to my treasured colleague, my very dear friend, Commissioner Tara Stamps, as well as our community partners who are here, for really bringing us all together to have this very vital conversation. Blood donation is not just important, it's life-saving. Every day, hospitals across the country rely on blood donations to treat accident victims, surgical patients, individuals undergoing organ transplants, and those battling chronic illnesses like cancer and sickle cell disease. Your decision to give blood can make the difference between life and death for someone in need. Let's consider some compelling numbers that highlight the urgency of giving blood. Every 2 seconds, someone in the United States needs blood. That means while we're here today, countless lives are being impacted by the generosity of blood donors. Only 3% of the eligible individuals who can give blood actually give blood. That is a strikingly small percentage when you consider the ongoing critical demand for blood throughout all of our communities and certainly here in Cook County. And 25% of individuals will need a blood transfusion at some point in their lifetime. This includes friends, your family, and maybe even you. Here are a few more facts to reflect on. A single car accident victim can require as much as 100 pints of blood to survive. Patients with sickle cell disease, which disproportionately affects African Americans, often need frequent blood transfusions, sometimes as often as every 3 to 4 weeks. Blood cannot be manufactured or replicated. It can only come from generous individuals like you and like me. In Cook County alone, the need for blood is constant. By donating blood, you are directly contributing to the health and well-being of your neighbors. I indicate whenever I can that I'm willing to give blood because I've had surgery and I've had to rely on extra blood. I often share that Galatians reminds us that we are here for 2 reasons: to love and to serve one another. Donating blood is one of the most profound ways to live out this purpose. Your gift of blood can save up to 3 lives with every donation. Imagine the ripple effect of that kind of impact throughout our community. Today, I challenge each of us to not only donate, but to encourage others to do the same. Share this message, inspire your family, inspire your friends, inspire your colleagues to join this life-saving mission. Together, we can ensure that no one in need has to wait for the gift of blood. Thank you for being here today. Thank you for your generosity. Thank you for your compassion. And thank you for your commitment to saving lives. Together, we're building a stronger, more equitable Cook County. I appreciate each of you. Thank you. It is now my pleasure. Thank you. It is now my pleasure to bring up Commissioner Michael Scott.
Good morning, everybody.
Good morning.
Again, I am Michael Scott, Commissioner of the 2nd District, and I want to thank Commissioner Stamps for bringing this issue to bear. This is a personal issue for me. Just like many of us, we have individuals within our family that have chronic health issues, and my Uncle Eric is one that suffers from a chronic health issue. And if it were not for people who came out and donated blood, he would not be with us today. He is in and out of the hospital because of various different issues, and it is because of special people who want to donate and give back to our communities. In addition to that, in communities of color, Black and Latino and Brown, we do not give as often as we should. And so I implore each and every one of you, members from our community, members from communities all across the county of Cook, to come out and save a life. As my colleague said before, this is a life-saving issue. If you come out and donate, each pint, you can save 3 lives. And so with that, I want to bring up Commissioner Miller from the far south side, who has some words as well.
Thank you. Good morning, everyone. Good morning. It's really an honor to be here today. I want to thank my colleague, Commissioner Stamps, for putting this together and building an initiative that affects so many people. We've heard the stats, but those stats are me. Those stats are my family. My sister suffers from sickle cell. She's in the hospital right now, waiting for a blood donor. And if I can just tell you the excruciating pain that a person with sickle cell lives with every single day, it's heartbreaking. And then the other thing on top of that is not getting enough for the kind or the level of medication that you need because they think you might be a drug-seeking patient when you are actually in need of medication so the pain can be decreased so that you can make it through the day. So I just on the phone with my sister this morning as we await for her to get a blood donor because it's hard to match. We've been living with this her whole life. I've been involved with blood donations and blood drives since I started in high school working for the Red Cross as a volunteer up until now where I've hosted blood drives throughout the country, literally, in many different aspects. But here on the South Side, I'm glad to know that this blood center will be focused on those in need because African Americans don't donate blood. We need communities to participate. We need this blood center to raise awareness, and there's not enough of us talking about it. So I'm so glad that this initiative exists. And I think all of us working together can help amplify those voices so that people like my sister, when they go into the hospital, the blood is there. So when you think about waiting for a donation, she literally waits. Right now, it's only been 24 hours, which hasn't been that long, but sometimes she's waited 2 weeks for a donor. Because once you get to the point where your antibodies have duplicated and multiplied multiple times, it's hard to find a match. That's why all of us, if we were getting ourselves out there as donors, those of us who can, we increase the pool for the people who need blood. So I take this very personal. I thank everybody here for their compassion and their focus on making sure that this issue gets talked about. And sickle cell is something that predominantly affects African Americans. And I've worked in genetic diseases in my past life, but this genetic disease doesn't get the attention that it deserves just because of who the people who are afflicted with it are. There's about 110,000 people, I think, have sickle cell. But we don't have the resources, we don't have the intentionality, so we need all of this to happen. So thank you all for being part of the solution. So next, I would like to introduce Lamikia Davis, who's the Executive Director for the Community Blood Center.
Thank you, everyone, and leaders in the community. Thank you, Madam President. Thank you to Commissioners Stamps, Daly, Laura, Scott, and Miller. And an extra special thank you to Commissioner Stamps for helping us put this initiative on. At the Community Blood Center, we see firsthand how important it is to have a diverse pool of donors. Blood donations from minority communities can make a critical difference, especially for patients with diseases like sickle cell anemia, diabetes, and those that experience blood transfusion during childbirth. I myself am a recipient of a blood transfusion, and it changed my life. I had food poisoning, and a blood transfusion saved my life at the age of 11. The Lifeline Save Chicago initiative is a powerful step forward in addressing healthcare inequities. Our goal is to expand outreach, build trust, and create sustainable donor programs in every corner of Chicago and the suburbs. We invite you to join us this Saturday along with Commissioner Stamps, January 18th at the Community Blood Center. We're located in Beverly. Together, we can ensure that everyone in the community has access to blood and resources that they need to thrive. Your donation is more than just an act of kindness. It's a lifeline for someone in need. Let's work together. Thank you.
Thank you all so much. Before we wrap up, I would like to bring up the CEO. But just a fun fact about Cook County with regard to this. The Fontes Clinic, Dr. Fontes was the first to house a blood bank. So in Cook County, for Cook County Hospital. And I think that just goes to show that we've always been committed to the community and wanting to make sure we had life-saving programs at Cook County. And so this just goes along with what our founding doctors believed anyway. So please, please, please take this to heart and donate blood. But without any further ado, just a couple of words from our CEO.
Good morning, everyone, and thank you so much. Thank you so much, Madam President, for the invitation. Thank you to all the commissioners for recognizing January as National Blood Donor Month. One of the stats that we hadn't talked about was 1 out of every 7 hospital patients will need a blood transfusion sometime during their stay. That's an incredible number of people that rely on blood transfusions for their health and welfare, and it can only be provided by volunteer blood donors. So in this month of January, National Blood Donor Month, thank you for the proclamation honoring those volunteers that come forward, and I encourage everyone to donate blood if they're able to and support their community. Literally, every donation can save up to 3 lives. So thank you very much for the support for the program. I want to thank Lamikia and all the staff at the Community Blood Center here in Chicago, and please donate blood. Thank you.
Okay, that is all of us. Are there any questions, concerns? I guess we'll go take care of the business of the county. Thank you all so very much, and thank you.